Okay, well, we are at, depending on where you are, 6 p.m. Eastern Time, 5 p.m. Central Time. So thank you to everyone for joining us. We had quite a few attendees register, and so I'm sure we'll have more people trickling in as we go on. But I wanted to just go over a few kind of housekeeping rules to introduce people to the setup, the Zoom setup, in case you haven't used it before. So none of our attendees have the microphone option, so you won't be able to ask questions verbally, but there is at the bottom of your screen a little Q&A function and a chat function. So if you cursor down to the very bottom of your window, you should be able to see both of those. And if you have questions throughout the webinar, you can always feel free to submit those. And we are going to hold questions and ask those all at the end. But I will be reading those as we go through, so definitely feel free to add those in there. And with that, I wanted to introduce Ellen Lennox-Smith. So Ellen is a co-director for the Medical Cannabis Advocacy at the U.S. Pain Foundation, and she's also a Rhode Island U.S. Pain Foundation board member. She has emerged as a leading voice for patients living with pain in Rhode Island and across the country, and has been featured in local and national press accounts. Ms. Smith brings a reasoned and compassionate perspective to the need for safe patient access to medicine. She suffers from two rare conditions. One is a degenerative collagen disorder called Ehlers-Danlos syndrome, a crippling disease which allows her joints to become easily dislocated, causing extreme pain and confining her on and off to a wheelchair. She's presently endured 24 surgeries and countless visits to her doctors. She's enjoyed a long and distinguished career, predominantly in the field of education. The last position she had before having to resign due to health was to teach social studies at the Burrillville Middle School from 1989 to 2007. Mrs. Smith has devoted much of her recent time to advocacy. She started using medical marijuana in 2007, and since experiencing what a change this made to her life, she became committed to advocating for it across the country. She is also author of 2 books, It Hurts Like Hell, I Live with Pain and Have a Good Life Anyways, and My Life as a Service Dog. And I think you'll get to see a photo of her beautiful dog at the end of the slides. And she's also shared many useful articles that I will be emailing out to attendees after the webinar. So she has provided us with a great amount of resources, and we are so grateful to you, Ellen, for taking some time out of your evening to share your knowledge and expertise with us. So please feel free to take it away.
Okay, well, thank you everybody for listening, and I hope you'll gain something out of this. I feel that if there's anything I have that has worked for me, it's worth speaking out and hoping that it might help the next person. So that's why I do advocate, and it personally helps me to cope with the conditions I'm dealing with, to feel like I might possibly have a positive effect on somebody out there. So moving forward, this is going to be my story why I chose to use cannabis. But first, I just want to put this disclosure out here that I have no financial ties with any organization. My advocacy is all volunteer as both a patient and a caregiver. This information from a medical professional is not from a medical professional and should not be taken as medical advice. I'll instead be sharing my personal experience that has worked for me. So let's start today with what is the difference from using CBD or cannabis. CBD is a big talk right now, and so many people are so concerned with hearing the word THC out of cannabis that they're totally ignoring the possible use of cannabis and just thinking they should just run and go use CBD. CBD is coming from the hemp plant. A hemp plant has less than 0.3% THC in it, and therefore it is legal to purchase across the country. CBD from the cannabis plant, on the other hand, is over 0.3% with THC included. So therefore, if you do a CBD from a cannabis plant, you must be a legal medical card patient in the state that you come from or the country. Children with seizures, just to give you an idea, they last about 6 months with wonderful success taking the CBD from the hemp plant. But in time, in about 3 months, 6 months, parents will find the seizures begin to return, and they need to get the THC in with a higher CBD plant from the cannabis to actually successfully, permanently take care of seizures. So there's lots of advantages of CBDs, but it may not always be the right match for those of us like you and me that live with pain. And unfortunately, except for the country of Germany, neither CBD or THC are covered at this time, or cannabis. There are safe places to consider buying hemp if you want to start and just try CBD because you're really scared about THC. Presently, just understand there's no regulations about using CBD. It can be extremely expensive, so you want to be sure you're getting what they actually advertise for. You don't want it to end up finding out that it has pesticides in it, that it's less dosage than they're advertising, and that does happen, unfortunately. I've listed 5 companies here that are safe and reliable that do offer CBD that you can count on. So if you're interested in not the cannabis plant and you want to start with CBD from the hemp, then I would encourage you to consider these companies. There are drugs that interact with the cannabinoid, I can't pronounce that word, sorry, any drug metabolized with these enzymes could potentially interact with cannabinoid. According to the Indiana University Department of Medicine, drugs that are known are listed here for you. So if you're already on any of these medications, then be very careful. The interesting thing is there's less drug reaction using the actual cannabis plant than there is using the CBD from a hemp plant. So it's very important if you're going to try CBD and you're on medications, very important to let your doctor know that, just to make sure any of these listed here, if that is something you're on, then you really need to discuss this with your doctor to try not to have any reactions going on. And here is even more items that you could possibly have an interaction with. So just look at this list to make sure there's nothing here that you see that's yours. And again, just keep in mind, I'm not going to give you this list for cannabis because that doesn't exist like this. This is specifically the CBD from the hemp plant that you have to be careful with interactions. But I'm not going to lie to you. Recently, I write for National Pain Report and also staff writer for 1000 Watts magazine. And the 1000 Watts magazine editor asked me if my husband and I would try some samples of CBD from the hemp. And they sent us the spray and they sent us these drops. So my husband took on the drops and I took on the spray, and I took one arm only, and I started spraying this on once a day for a week. And I'm 68 years old, and strangely enough, I looked down at my arm a week later and my aging spots literally were going away. And I was shocked. I really hadn't expected any reaction at all, having been a person using cannabis all these years. But there is something to CBD, and you just never know. It can't hurt you, so it's worth a try. Okay? Now, the cannabis plant is with THC. I don't want you to be afraid of using this. Many of us living with pain need the THC to help with the pain. Don't assume that you're going to get high unless you take too large of a dose for your body. It's just like any other medication. If you take too much, there will be side effects and reactions. But if you take a dose that's correct for your body to metabolize, then you're not supposed to be getting the high. Generally, if you and a friend who does not have any medical condition take the same dose of cannabis, you're going to get pain relief if you take a dose that's not too high, and your friend's going to get a person that will get high from it. They'll get stoned, not you, because a body with pain reacts differently. But it's very important if you switch to the cannabis with the THC, the real cannabis plant, that you must start slowly to introduce it to your body. I know we live with pain, and the first thing you want to do is get rid of that pain. And I had one person didn't listen to the instructions, took some oil home, and ended up taking a whole bunch of it because they were in so much pain. And yeah, they had a lousy night. That's just not how you do it. You want to slowly introduce this into your body if you're going to take it in a form like I'm going to explain to you, in an oil form where you actually ingest it in. There is less drug interactions, interestingly enough, with cannabis over the actual CBD from the hemp. And the way I use it, it activates while I'm sleeping. I literally take my medication about 45 minutes before I go to bed. And by the time I climb in that bed, 45 minutes later, I'm ready to close my eyes and zone away and go to sleep. And if you get the dose right, I wake up in the morning, I'm not groggy, and I'm able to function the next day. And I'm to the point now, despite 24 surgeries, 2 incurable painful conditions, most of my days I take nothing all day long until the oil at nighttime, and it carries into the next day, keeping my body calm. Of course, there's levels of days where the pain gets higher than others, but I still don't feel like I need to be taking, very often turning to medication. So the choice I made, and I can't exactly tell you was that I made it, it was actually my doctor decided for me, was cannabis. Let me make sure I got to the right choice. Okay, so this is how I use it. Due to the sarcoidosis in my chest, along with the Ehlers-Danlos, I'm unable to smoke anything. It would literally be fatal to smoke. So that was never an option. When I went to the pain clinic doctor and he suggested I try cannabis because I'm not able to even metabolize aspirin, Tylenol, or any of the opiates, my body is so drug reactive that I immediately had to take the product and convert it into an oil that I would end up taking during nighttime. I was scared to death, I'm not gonna lie to you. I started this in 2007. The only time I had ever tried cannabis was in college one time. I hated it. I spent the day in bed feeling like I was going in and out of the feeling of sodium pentothal. I thought, why would I want to spend the rest of my life feeling like that? I think I'd rather live with pain. But I listened to the doctor and I did convert it into the oil, warned my husband that I was taking my teaspoon and I was going to go to bed and thinking, oh, I'm going to be a messed up woman. And instead, next thing I knew, I woke up the next morning. I literally, for the first time, slept the entire night. So the beauty of this way, and I had no choice at the time when I was asked to try this, it was really the safest way for me to do it, is to take it at night. But I find that it's so wonderful that it's activating while I'm asleep. So I never have to feel anything except restful sleep going on at the time. So I've included the link of how I make various things, specifically the oil that I use. It includes, if you click on this link, it will include the directions of how to make it, how to take it, and it's very, very important that you read those directions carefully and start slow. Most people I have start at just 1/4 teaspoon, and understand that when you take this oil, you don't want to take oil in an empty stomach. You want to mix it with a little bit of food. I put in a little paper cup. I'm right now at a teaspoon to sleep through the night. There was one point in my life I was at 4 teaspoons, to show you that this is not something I'm addicted to. I never once have this desire that I have to hurry up and go get my oil. And if anything, I've actually been able to reduce through the various surgeries to help correct some problems in my body. I'm down to only needing 1 teaspoon for the night and into the next day. That carries through. But again, you want to take that oil, mix it in a little paper cup with some type of food. You don't want just a teaspoon of oil in your belly, or you could get a stomach ache. So applesauce, yogurt, something that you can tolerate. I'm not talking a lot of food, just enough to mix it and take it down together. There's also tinctures, and there's recipes for that on this link. A tincture would be made with a day medication. I'm going to explain that in a minute. And that would be for breakout pain during the daytime. You simply put a teaspoon of this tincture, that's very simple to make, either under your tongue or in your cheek, hold it for about 20 seconds and then swallow it down. And that can be used very frequently. It's like every 20 minutes, if you're feeling pain coming back, you can use more tincture. So that's always an option. Also, we have a recipe there for making a topical. If you're having an area of your body that's really hurting, it's these topicals made from the same oil that I use for nighttime, but it's mixed with beeswax and peppermint extract, so you don't even smell cannabis at all. All you smell is peppermint when you put this on. And the peppermint helps to open the pores. It helps the medication to absorb through. Topical use of cannabis is the only way that it's not going to show up in your blood system. Any other way you use this, the oil, the tinctures, any other way is going to show up in your urine if you're concerned about that. There is also an option of juicing. I met a Dr. William Courtney out of California at a conference one time. I was in a wheelchair, leg braces, just gotten out of surgery, and he started talking to me about his research he was doing on juicing. And I'd never heard of this. The big fan leaves on a plant that most people end up throwing away are actually from the cannabis plant, are loaded with CBD. And no concern about THC when you juice. You take the big fan leaves, you get a Vexin juicer, put the leaves through, and out comes this lovely dark green juice that you mix with something else that you like the flavor of, and sip that 4 or 5 times a day, and you're getting CBD from the leaves directly into your system. And that can be very efficient. I literally, the year before, had a fibula repaired with a cadaver tendon. It took 6 months for it to heal. The second year, I did had the other leg done out in Wisconsin. I had just got home, just met this man at a conference. He tells me about juicing, sent me a juicer. We happened to be home growing, so I had access to the leaves. I juiced the leaves, and within 2 months, I got a call saying that I no longer had to be wearing the brace, that it actually had already healed. The only thing I had done differently was juicing those leaves. So there's something huge to that. Lollipops, there's also a recipe for that, or you can make just plain hard candy. So hopefully you will find this site helpful to you. And let's see if I can get to the next one. Here we go. So the benefits of the cannabis oil. Again, it's much safer for your lungs not to be smoking the medicine. It's easier to store and travel with. I have traveled the country. I've never, ever had anybody go into my medical medicine bag and open up a bottle of oil to smell it, ever. People don't do that to you. If I had brought a package product, dried product, believe me, that would have been a whole different ballgame. But oil, as in a medicine bottle, which is how I travel with this, is private and it's easy to move around with. So I'm able to travel with my pain relief. And for many, achieving their true dose can mean less need of medication during the day, for it does keep the body calm into the next day. We have found that using more than one type of night indica plant actually creates a great sleeping oil. If you can get the clippings from these indica plants, they seem to make a wonderful oil. And I'm going to explain a little bit more what I mean by night plant versus the day plant. But again, about the oil, remember that when ingesting the medicine, you have to allow time for it to be absorbed before you're going to get relief from your pain. When you swallow cannabis down, it's not going to be a quick, instant pain relief. It will be when you do the tincture during the daytime in your cheek or under your tongue, but not when you swallow. That's why I say to you, 45 minutes before I want to go to bed is when I first take the medication, but yet I don't begin to feel that relief from that medication for at least a half hour. So, you want to time what time you'd want to go to bed if you're going to do it this way. And I would suggest an hour before you're going to go to bed when you first start using this, take the medication. Then within a half hour, get yourself settled in bed. You need to start with a much lower dose again to introduce this to your body slowly. And for sleeping, again, an hour before you want to go to bed for the night. So you give it time to begin to react. And let me just go back here for 1 second and say, if you ever take too much by mistake and you wake up groggy and it feels really weird, do not panic. No need to go to a hospital. It will wear off. It's not a fun feeling. That's why if you start slowly, what your goal is to sleep through the night, wake up not groggy. If that has been achieved, then stop at that dose and don't keep adding more. If you haven't gotten there, then just add a little bit more each night. But don't panic if that happens. It will last for a couple hours into the morning and then it will wear away. You're going to be okay. Nobody dies from using cannabis. So what is the name I should ask for? And here's the answer. We don't all react the same with each type of plant. Despite you all having the same condition, One of you might do great with one strain and somebody else is going to do wonderful with another strain. I have spoken to a room full of people with my condition, and if I handed out what I used, it would not be the match for everybody. So you have to be a little patient to find what your match will be. Dispensaries or compassion centers, whatever they call them in your state or your country, are very helpful on helping to direct you what might be best to try and how to use it. But be careful. There are two types of categories that you need to consider that have many different names of strains. So let's start with the first one, indica. Indica strains are higher in CBD and lower in THC count. The qualities they are good for, they increase mental and muscle relaxation, they decrease nausea and acute pain, they increase your appetite and dopamine, and they are preferred for nighttime use. Once in a blue moon, we've had a patient who's taken a nighttime indica oil during the day and had success. But generally, most people, if you take a nighttime plant oil and you take it during the day, most people will just be tired and want to go to sleep because that's what it's meant to do. It's meant to relax you. That's why you want indica plants for nighttime. The opposite are sativa strains. They are lower CBD and higher THC. Qualities they work with are anxiety, anti-anxiety, antidepressant. They help also treat chronic pain. They increase focus and serotonin. They are preferred for daytime use. I am not going to lie to you. I'm 68 years old. I was scared to death to try this stuff. And for years, I didn't even try a daytime strain after I got myself to accept trying the oil and realizing how successful it was. And one day I had all this work to do on the computer. I was not feeling good. And I finally thought, this is stupid. I make the tincture for everybody else. Let me try it. Next thing I know, I'm sitting at the computer doing my work. And I was focused. I thought, oh my God, what was I waiting for? So don't be afraid of this. And it's not going to hurt you. And it does help, along with reducing pain, it helps to stay you focused with a sativa daytime strain. Now, can I reduce other medications? Many are able to eliminate other medications such as opiates, gabapentin, etc. As you achieve your proper dose with cannabis, you can consider slowly reducing other medications if desired. But remember to reduce only one medication at a time, because you want to be sure it's effective to remove that. You don't want to suddenly remove everything altogether. And don't compare to other people. We all are going to require different amounts and different strains for success. So what works for one is not going to be the magic for another, unless you get lucky here. Caution, you don't want to take a day sativa strain at night or you will not be able to go to sleep. That's a stimulant. Pain relief, yes. Stimulant, yes. So you don't want to take that at night. Any more than you don't want to take a nighttime indica strain during the day, or for most people, you're going to be tired and sleepy. So you want to make sure you understand, is this an indica or is this a sativa? Because you want to know when you're supposed to be using this. So I'm gathering most of you are pretty worried about the thought of THC in a cannabis plant, but you need help with pain. So you want to consider asking for strains. One way to slowly get yourself used to using cannabis is ask for strains that are higher in CBD and lower in THC. Day sativa example, wonderful for PTSD and anxiety, is called ACDC. For nighttime, I happen to make my nighttime oil mixing all of these: strawberry diesel, catatonic, critical cure, and purple god. But these are just only a few of the many, many names that are out there. The most important thing you need to do is remember indica night, sativa day, and then could I please consider trying a higher CBD indica or a higher CBD sativa, just to break yourself in. Now you might find that that's not enough and you're going to need to go to something that has more THC in it. Don't be afraid of it. Trust me, I wouldn't be advertising this if I was afraid of it. It's just, I'm shocked at how much it helps me. But no matter what you do, I just want to mention for all of us, no matter what condition we're facing. If we have inflammation in our system, no matter what we're facing, that is going to cause more pain. Two things that are very important, at least for my condition, and it can't hurt anybody, is consider a food sensitivity testing to make sure there's nothing you're putting in and chewing and swallowing that possibly your body's not able to metabolize. The ALCAT or MRT food sensitivity testing is normally here in Rhode Island, in the States, is ordered through a dietitian, but I'm sure a doctor could also order this. And that will give you a list of foods that at the time are not compatible to your body. It will break your heart because sometimes it's wonderful food that you love to eat, but if it's making you getting more inflamed, that's just not going to make you feel better. And the other thing to consider is the DNA drug sensitivity testing. I happen to use the one from the company called Genelix. That will map out through a simple swab of your inside of your cheek, and you mail it to the company. In about a week and a half, you get a map of your body for the rest of your life to use, showing what you can and cannot metabolize. So if you can stay away from medications that suddenly show up that you've been taking, you didn't even realize were not compatible, that will also help to reduce your body's inflammation, thus having less pain. Now, options for how to use cannabis. This is a picture of the Lexon juicing machine. You can see the dark product coming out and the juice on the strainer that's coming through from these leaves. Here's a picture to the right at the bottom of topical containers of the topical that we make, and we've also made hard candies one time for a patient. So we have oils, juicing the large fan leaves. People vaporize. We, in Rhode Island, encourage people, instead of smoking, at least vaporize, because even with sarcoidosis in my chest, the pulmonologist had no problem with me vaporizing. I personally don't prefer it, and I don't feel like I need it because I'm so successful at taking the oil at night. But if you're going to choose smoking over vaporizer, go get a vaporizer and use that instead. Then, you know, just so that someday they don't come out saying, "Oh my heavens, you know, smoking cannabis is hurting our lungs." This way, you're avoiding that by vaporizing. You're going to look like you're smoking. You're going to draw in, and when you open your mouth and let what looks like smoke out, it's only vapor. It's going to look like smoke, but this is the safe way. You pops, there's candies, there's tinctures, there's edibles, there's smoking. There's patches now and drinks too. But for edibles, depending if you happen to be a person like me with food sensitivities, edibles sometimes can be a problem because you may be reacting to the food in the edible as opposed to cannabis. And the other thing is, remember, edible means you're chewing and swallowing, just like the oil I take you swallow. You're ingesting. That's not going to activate immediately. It's going to take up to an hour or maybe more, depending on your body. So I can't tell you how many people I've met that got this delicious cookie with cannabis in it, took a bite in it, didn't feel anything, and they ate the whole cookie. And then an hour later, they're stoned out of their gourd because they didn't realize what they were doing, and they ate the whole thing, and they didn't even know how much medicine they're getting into them. Be very, very careful with an edible. Make sure you calculate how much medication you need and take it slow with that. Now, depending on your state or your country, if you're able to, consider home growing. This is just showing you, this is the inside. On the left is what's called the flower room. And we have an outside attached to the house greenhouse that you can't even visually see into. We use this during spring until the fall, and that way nature takes care of everything except for we have a dehumidifier in that room, and a fan comes on if it gets too warm. Otherwise, it's totally controlled by nature's light, which is very convenient, and that's the least expensive way to grow your plants, to build something like this. The picture on the right shows you the vegging state. In this area, this is where the plants have been cloned off of a female plant. A male plant produces seeds, so you don't want to grow a male plant, you want to grow females. So we take a plant like this, clip off a piece, and root that to keep that strain growing. And when it gets tall enough, then we move it into the room on the left, which is the flower room. And the difference here to here is is how much sunlight it's getting. Once you cut it down to 12 hours of light and 12 hours of darkness, it forces the plant into flowering. And just to give you an idea, it takes about 3 months from the beginning of cloning a plant to actually being able to harvest it. So cannabis was used for medicinal purposes prior to the 1800s. Humans have cultivated and consumed the flowering tops of the female cannabis plants since virtually the beginning of recorded history. Cannabis-based textiles dating to 7000 BC have been recovered in northern China, and the plant's use as a medicinal and euphoric agent date back nearly as far. In 2008, archaeologists in Central Asia discovered over 2 pounds of cannabis in the 2,700-year-old grave in ancient mummified China. So this has been around for a long time. It's really a shame that for some reason it was decided that this was a nasty thing and inappropriate. And here is something that used to literally be for sale in our own country at one time. So where does the government of the United States stand today? Unfortunately, it's still considered illegal under the federal law. It's treated as a controlled substance. Prosecuting cannabis cases are not a priority anymore, however. There is legislation in DC right now to bring this out of control, out of Schedule 1, which is right now it's being scheduled with something like heroin. Therefore, it means it can't be even researched, and that's ridiculous. So they're working to get it out of Schedule 1 to stop scaring people about this and let the states have control. And eventually, I believe there's like 30 countries that now have full citizen use of cannabis, and we'd like to see that here in the United States. The VA has updated its policies. The veterans are no longer denied services because they've chosen to use cannabis. It's still kind of tricky because of the federal law. But brand new is the FDA has provided CBD being approved. So it's a oral solution that is now going onto the market. So let's see, are you possibly interested in considering this? And if so, where would you begin? Depending where you're going, every person in the state that you live or the country you live, at least here in the United States, you must have a medical cannabis card to identify you as a patient. Let me just go to the next slide. So what you want to do is find out if you would qualify with your medical condition in your state. So there's a link right here that you can click on. This site lists qualifying conditions state by state and where to find more information. Many states have programs, but you must have a certain condition to qualify into that program. Let me just go back here for 1 minute and just say that if your state is legal, and we're only down to 3 states left that do not have any program. There's a pile of states that have no real medical cannabis program, but do allow CBD, so that's opening the door and beginning the process. But I just lost my train of thought. I was going somewhere with this, and sorry about that. It's me getting older, sorry. Okay, so you're interested in, oh, I know what it was. What is very helpful is if your state has the qualifying condition of chronic pain, then you're going to be able to begin getting a qualified patient. If you do not have the word qualified pain, then you're in trouble like I would be with a rarer condition, because there's no way every state can list every single painful condition that's out there. The dream of the future would be that our doctors get to practice medicine with us, and they decide with us whether or not we should consider using cannabis. And if not, the next best step is that one of the qualifying conditions is chronic pain, so you will qualify. So let's say you do qualify. You've looked up your state. It looks like you could get in. You're interested in trying. So the next step would be to fill out the form that's normally available online to download. You normally would go to your Department of Health and put in the words medical cannabis and bring up that application. Now, states are going to differ in the application process, but you typically are required to have a doctor's note or a medical record stating that you have one of those listed conditions before you can apply. You want to approach a trusted doctor about signing that form confirming you have the qualifying condition. Very rarely are you going to find a doctor that has no relationship with you that's going to want to sign that form. Here in Rhode Island, we've protected people in case they ended up with a doctor that was not willing to sign for them. And we have 2 or 3 places now that people can go to for a fee with their medical records. They set up an appointment, they bring their medical records in, and the doctor that's on staff there is there specifically to review your records, and if you qualify, sign your form for you. So we have the choice of going to a regular doctor, just paying a copay for that appointment, and or signing up for one of these centers where a doctor is on staff to review your application. But again, that is for a fee. Tips for applying. Once you are approved, dispensaries are going to be very helpful and can give you tips on the application process also. There's generally an out-of-pocket cost associated with being certified by a doctor and with registering with the state. At this time, no insurers cover medical cannabis except lucky country of Germany, and we hope to see that for the future. And once we can get this out of Schedule 1 and more, and possibly all states include cannabis, then the next step will be to fight for the rights to have this as a covered medication. So let's say you're now approved. What do you do next? Ask questions. Go to one of those centers. Speak to a specialist or find a friend that's been using it successfully. Medical cannabis experts, someone from the dispensary, cannabis-focused, nonprofit, etc. The benefits of doing this are they'll help you provide the dosage device, ingestion methods, and product type. Find a reputable dispensary if you're not able to home grow. Ask questions. What are their testing procedures? What type of products do they carry? And are there patient care services or educational classes that you consider joining into? And remember when you talk to them, indica for night, sativa for day. If you're living in a state without a medical program, you could possibly consider advocating. So many states are so close to moving forward at this time. A voice is very important. So that's the picture of my husband and I. We advocate for the U.S. Pain Foundation and also here in our state of Rhode Island. You want to advocate for the right wording. Along with sharing your personal story as to why this could help improve the quality of your life, you also want to discuss what the qualifying conditions are to be on the bill proposed. There is no way they will ever include listing every possible condition that causes pain. Therefore, it's very, very important to include the following in your bill: severe, debilitating, chronic pain. And if you don't get that wording in there for chronic pain, you will not ever qualify. And it's really frustrating. Most states are leaning towards adding this on. Some states are going beyond that and giving up on listing everything and just allowing the doctor to make the decision. And that's the best choice in the end. Future goals for all states, that all states allow medical use, that all states include either chronic pain or allow the doctor to decide who qualifies, that all states join Germany and have it covered by insurance, all states keep the prices affordable, allowed home grow, and use quality control in those centers. And then also let's see it removed from Schedule 1, allowing for research. So many times a doctor will be afraid to sign on because they said, oh, there's no research out there. Well, go look up cannabis and Israel. They have been researching cannabis for years. They have unbelievable documentation. That's because they don't have it in Schedule 1 being locked up and not being allowed to be researched. So good for them. Remember, no one dies using cannabis. There are very few side effects unless you make the mistake of taking too much. There are few drug reactions, unlike if you use CBD from the hemp plant. That is a concern with drug interactions. And remember, go slowly introduce these to the body and don't use more than you need. So I'd like to thank you for listening. This is a picture of me, and this is my service dog, Maggie. Just to briefly let you know, you all would most likely also be qualifying for a service dog. She happens to come from Princeton, Mass. At a place called Needs. pretty amazing experience. I applied, waited 8.5 months to be matched, brought her home after 2 weeks of training, 8.5 months later, and 6 days after bringing her home, a dog that was not trained to do this recognized that in the middle of the night on Thanksgiving early morning, I had literally stopped breathing, jumped up onto my hospital bed 6 days after coming home with her, saved my life, repositioned me with the BiPAP machine on, brought my breathing and airway back, and saved my life. And now literally goes to the pool with me, lays at the end of the lane. I kick in the water. I can't use my neck and my arms anymore. I used to be a master swimmer, but she is able to monitor my breathing. And if my oxygen levels are starting to get cut down, she will go from sound asleep to sitting up and staring at me at the pool in the lifeguard seat, and they say, okay, time to get out. So it's a pretty incredible experience. I'd like to have you see that I've given you 2 email addresses. One's my personal email address, a Gmail account, and also the U.S. Pain Foundation. I want you to feel free to email me if you think of something later on that you want to ask, or you'd rather not bring it up in public, that's fine. I'm more than happy. I promise you I will write you back. Okay, so do we have any questions?
Shockingly, I have not received any yet, but I did want to remind people, I forgot to mention this before we started, that this webinar is being recorded. So if you're just trying to wrap your head around all of this and you want to be able to go back and hear Ellen's expertise as she's going through the slides, you will be able to access a recording of this presentation online at our website. But Ellen, first I wanted to say thank you so much for sharing so much about your journey and your knowledge, and even a little bit about your experience with your service dog. And while we're waiting for people to, if anyone does have questions, you can put them in the chat window. I did send out the link to access that you had on the screen, Ellen, where you can see if you qualify in your state.
Okay.
I have a few questions, just some things that I was wondering about. So I was going to ask, how would you recommend finding a doctor who can prescribe you once you've gone through the steps of checking your state and reaching out to your health department? I know you said a trusted doctor, and my question is, are all doctors certified to prescribe medical cannabis, or is that something that only you would have to find a specific doctor for?
Right.
And do you have?
Well, right now, it's not a prescription that the doctor is going to give you. What the doctor will sign is confirming you have a qualifying condition. And then, in most cases, your work will then be with the dispensaries or the compassion centers or other people growing, because generally, most doctors do not have the knowledge of how to tell you how to use this. So, that's where the dispensaries are very knowledgeable and very helpful. So I know it's different, but you're going to be doctoring yourself more than you realize, which isn't always such a bad thing. I think those of us with rare conditions have had to learn to kind of do that anyway. And so you're going to have a little more control in this way. It's never going to be a thing where a doctor is going to give you a script, hand it to you, and like you go to a pharmacy. It just doesn't work that way. What the doctor's instead signing is confirming you qualify and signing their name to that, and then that goes with your application to your Department of Health. Then you get your card, and then what? Then you go to the center, or you go to a caregiver that can grow for you, or you grow for yourself, and you learn how to adjust the medication and the dosaging with other people helping you out. Does that make any sense?
Yes, thank you. I'm sorry that I overlooked the prescription versus.
Okay, no, I'm glad you asked that.
And so that could be any doctor. That could just be your regular primary care doctor who could sign.
Correct. And each state's different. So that's why you want to go to your state, read the rules and regulations. When you click on the Department of Health for your state, if you have a medical program, read what it says. Some states are now allowing nurse practitioners to sign. It's different from state to state. I look forward to the day we can have one general program and tell everybody this is how it's going to be no matter where you live. Right now, that's not how it is. So in our state, right now, it's only doctors that can sign. Some states, it's doctors, nurse practitioners, you name it. So it really depends on where you live. Okay.
One other question I had was, you had mentioned the different options for administering cannabis, the oils, the tinctures, the tropicals, the juice. So and I think you did say that there's different methods or different options available at this dispensaries. Can you speak to if that's common that they would have all of those options, or if it's more common that you would have to buy the product and then make your own?
No, I think it's very common once the state gets running that you're going to have tons of choices when you walk into a dispensary. It's kind of a little bit overwhelming, so let somebody help you, because one thing I want to warn you about is they have this little syringe that a lot of people are being sent home with, and they tell you to have the size of a piece of rice of that syringe oil, and it's really, really, really intense. So I would take half of what they tell you to introduce that to your body, so you don't get scared of this, because I hate to see somebody take and think, oh, piece of rice, I might need a little more than that, because again, once you ingest that oil down and it kicks in, it sticks with you for a while. So start slow. No matter what they say, just start slower than what they say. But I'm shocked every time I go back to a dispensary and look, the options are ridiculous. I mean, a cooler with drinks in it, all different types of edibles, all different types of strains, syringes, oils. It's unbelievable. So you really are going to be overwhelmed when you walk in there. Get a one-on-one appointment with somebody, have them sit down, share what you're going through, share how you feel. If you're a little scared like I was with this, say that to them and see how you can start this process slowly. Okay?
Wonderful. Well, I still do not have any questions in the chat or the Q&A, so I know that you have made yourself available afterwards, Ellen, and I'm sure that there's people who will take advantage of that. And thank you again for, being not just a resource for the FOP community at this time, but for offering to stay in touch with the people who are on the webinar today. That is, it's wonderful that you're so willing to help out another community. So,
well, I know if one person gives us a try and has the success I've had with it, it literally has given me a life back. I was so reactive that I really was to the point that was teaching. I was still trying to teach, and I was dealing with reaction to medication on top of pain. So I finally said, well, this is stupid. I'll just deal with the pain. Because if you're reacting and taking pain medication at the same time, what's the point? So I would just deal with the pain, and all of a sudden I take this, scared to death to try it, and I'm sleeping. And I don't care what you have wrong with you. If you do not get sleep, you can't think and you can't function. So imagine waking up in the morning having slept an entire night. And that's what I do most nights. The only time that does not happen is if my sternum slips in and my trachea turns, and that cuts off breathing. Otherwise, I go to bed and I wake up and it's morning. Every morning, I'm still to this day shocked. And I've been doing this now since 2007. I'm still absolutely shocked that I wake up and it's morning. I'm just not used to sleeping. And it just has changed my attitude in life. It's given me hope and positive feeling. It's allowed me to do advocating and doing things like this. I never could have done this if I weren't on something that was calming the body down. So I hope you won't be scared to try this. I hope you'll remember to start it slowly, and remember nobody dies from this. There's very few interactions at all, and most people are able to eliminate a lot of the medication they're on because this is so calming. So I just hope it will work for somebody out there too.
Great. Well, thank you so much for advocating and doing so much work for this cause. And I did want to also say, I know most of the attendees, but I realized that I forgot to introduce myself when this started. So my name is Hope Newport. I'm the Family Services Manager here at the IFOPA. And if you have more questions about this, about the information, I will be sending out a follow-up email, but please feel free to reach out to me. I will have my work email included in that follow-up email, and I'm happy to connect you with Ellen if that's helpful, or to answer questions about other resources you have from the IFOPA. So yeah, but thank you everyone again for joining us, and thank you again, Ellen, and I hope you all enjoy the rest of your evening or morning, depending on where you are. So,
And Hope, can I say one more thing? You know,
yes.
if somebody just wants to even have a conversation, I have no problem with that. Email me, tell me that, give me your phone number, and I'll call you. I don't have a problem with that at all. Okay?
All right. Thank you so
I'll give you
much.
my number. Okay?
All right. Thank you, everyone. Thank you again for joining us, and we hope to hear from you again soon.
Take care. Thank you, Hope.
Yep.
Bye-bye.